know that in the US, over 19 million women live in areas without adequate access to reproductive health care, according to the National Institutes of Health? Many women do not have equal access to reproductive health care, which causes serious problems for their health and well-being. The relevance of today's speech is to explain how women's reproductive health care is limited by barriers and to help you understand that it affects everyone. I am a woman who is concerned about the future and would like to know that I have options to my own body and that the women around me also are educated. I'm going to talk about the barriers, consequences, and possible solutions to these problems. First, talking about the barriers of accessing reproductive health care. The first barrier is a geographic barrier. Distance to care and limited availability of services make it difficult for women in rural areas to get care. Being far away from specialized care could be a burden when you need transportation to get there. And also, specialized doctors in urban areas involve longer wait times if you live further or to get specialized care. Economic barriers like high-priced services like contraceptives, abortion, and prenatal care. Insurance hardships, which are some insurance plans do not cover reproductive health care in general, and it scares women away from asking for help due to the high price. And limited access to subsidized programs like Medicaid and other subsidized government programs. It is unavailable or underfunded in some areas, and eligibility restrictions do not help women who are slightly above the financial threshold. Social and cultural barriers, judgment and shame, limited or not acceptable to some cultures and religion, and it is embarrassing to younger people, which make it hard for younger people to talk about their sexual education. And misinformation and lack of education. Incorrect information and myths are given, which lead women to believing incorrect statements, and women are uninformed on the many options involving their sexual education. Legal and policy barriers, abortion restrictions, and contraception availability. States and countries have implemented laws and bans on abortion, which hurts some women in some ways. And some women must put a certain amount of time between their counseling and receiving the procedure, which is a burden. Restrictions on birth control prevent women from practicing safe sex while saving their body from having a child, if they don't want it, of course. And insurance issues make it difficult to obtain some forms of birth control, required prescriptions, and some insurances do not cover the forms that you want. The consequences for a lack of women's reproductive health care. Health issues, higher maternal mortality. If women don't get care or help before they have a child, they could run into some issues that could put the mother's life at risk or even death. And the CDC's National Center for Health Statistics says the most recent report mentioned that there are 32.9 deaths per 100,000 births, which if we can get that number lower, it would be the ideal situation. Unintended pregnancies, there are millions of unintended pregnancies a year, and that can come from a lack of contraceptives and planning services, and physical and emotional consequences come with that. If a woman can't raise a kid because they're not financially ready or unhealthy, it could lead to problems in the future. And unsafe abortions. If a woman can't get an abortion, some people will choose the alternative route, which leads to more risks and even death as well. The economic impact, limited financial independence. Women must be financially stable in order to raise a child properly. Women will be forced to leave the workforce and education if an unplanned pregnancy comes and they're not financially stable. They will be forced to drop out anyway, and they need the money to work for the kid. Struggling to afford a child could negatively impact them in the long run. And high healthcare costs may not help financially struggling women when treating complications from the lack of preventative care. Social inequality, stigmatisms and discrimination, opinions and stigma around women's reproductive health care can further women from seeking care. Women who are affected by decisions made, putting limitations on what a woman can and can't do. The educational gaps, women who have to drop out of the workforce or limit their education won't be there in the workforce in the long run, and it widens the gender gap in education and employment. Possible solutions to improve reproductive health care access. Number 1, policy changes. If you increase funding, the government will put more money towards reproductive health care resources, expand insurance coverages. Insurances should cover healthcare, reproductive health care, because it'll help. Rethink policy and laws. Legal barriers such as limitations and bans should be talked about more and allow women to have more choice on what they should do with their body or what they can do. Educational programs is another solution. More sex ed classes to teach young people about different things. Awareness campaigns to have people more aware about their sexual education and to have the myths busted. And then global efforts, but they're community-based. Mobile clinics bring reproductive health to people who are in rural areas that need help. And telehealth, which is phone call doctor appointments. And affordable community centers, which women can go to in order to get their stuff done. Today, I hope you learned about women's reproductive health care, and I hope you have a different perspective on what women's reproductive health care is, and agree that a solution needs to be found to address and help the lack of resources given to women today. I talked about the barriers, consequences, and possible solution, and I want you to know that many women do not have equal access to the reproductive health care, which causes serious problems. My final statement is, I hope you learned a lot today, and I hope you do good with this information.